Thank you, Patty, and welcome everybody. I will be your moderator today. I am the Laerdal RQI Impact Manager. And as you can see, the title of our program today is Implementing Resuscitation Quality Improvement, RQI, in Schools of Nursing. If you've registered for this webinar, I'm sure you probably already know what RQI is, but just let me give a quick definition. So RQI is the American Heart Association's digital, self-directed certification and competency-based educational program for BLS and for advanced life-saving. And we're bringing this roundtable discussion to you today so that you can hear from real customers and how they've implemented the program and the results that they're seeing. So let me review the learning objectives for you. So we hope today you're going to walk away understanding how RQI can certify in basic life support, but also enhance the skill acquisition and knowledge for your students. We want you to learn how to shift from the traditional training methods for BLS to using RQI. And we'd like you to recognize the alignment of RQI with competency-based education. We hope that you will evaluate from what you hear today how these nursing and allied health programs have integrated RQI into their curriculum and consider the positive outcomes that have resulted from their implementation. And lastly, we hope that you'll walk away and you'll want to explore with a Laerdal Impact Manager if RQI is right for you. So let's go ahead and we're going to introduce our panelists. So going from left to right, we have Dr. Yolanda VanRiel. She is Department Chair of Nursing at North Carolina Central University. She has many years of nursing experience, and she's also has been a nurse educator for many years. North Carolina Central University was one of the early adopting schools for RQI and has 2 years of RQI experience. Later in our webinar, we are going to explore with her how she designed a unique RQI integration into her simulation experience for her students. And we have Julie Paul. She is the Associate Dean of Nursing and Allied Health at the Community College of Allegheny County in Pennsylvania. Julie started as a nurse, and she did work in neonatal intensive care. She's pursued higher degrees in nursing leadership and administration and is currently pursuing her PhD. The Community College of Allegheny County has been using RQI for just a little under a year on 5 different campuses. And we have Dr. Kyla Newbould, who's the Director of Nursing at Frederick Community College in Frederick, Maryland. Dr. Newbould has extensive emergency medicine experience, and you will hear today how Dr. Newbould continues that passion for emergency preparedness and quality improvement. Frederick Community College has been using RQI in all the allied health programs for just under a year as well. So I want to thank our panelists today for their generosity of time and for sharing their RQI journey with us today. So let's go ahead and begin our discussion about why RQI. So you're all aware that the current standard for pre-licensure students is to certify in BLS prior to your start in clinicals. And students can find and pay for courses on their own and then provide that documentation to the school. This certification has been treated as a task, check the box, and the students are required to keep it current while they're in school. But there seldom is time really to go back and refresh. And so if schools haven't been doing this, we'd want to ask the panelists, why would you want to bring a CPR program into your school? Let's begin. I see Dr. Newbould, you're on the screen up there. Would you like to begin and talk about why you decided to adopt?
Absolutely. We have, I heard about RQI through one of these webinars and was really intrigued to bring RQI to our site because our students are going right into clinical very early in the program. And in the first few weeks, they're always seeing a code. And we found that they didn't always know what to do. They might have taken the course before they came into the nursing program. but they didn't always really know what to do, or it had been a while since they had that course. So we really wanted to get them to make sure they were competent to go into a code at the hospital and be ready to be included in the compressions and be comfortable in what they were doing and show that confidence. We'd heard that students had been hesitant to join in because they didn't have that confidence, and we really wanted to make a difference in that.
Thank you for that. And I agree. It is very intimidating, especially when you've got to do CPR in front of other people. I remember that as my own experience as a nurse. So thank you for wanting to make them practice ready. Dr. VanRiel, would you like to share with us why you brought RQI into your school?
Sure, thank you. So the RQI program was introduced at the Dean and Directors Luncheon at the NLN Education Summit in 2021. And once I was there and viewing it, the station was also present so we could actually practice. And I knew that participation as a NLN change agent or early adopter supports the mission of my nursing department, which is to prepare compassionate and caring nurse leaders in healthcare who transform communities. And also, as a leader in clinical practice, I've seen when nurses knew and experienced deliver ineffective compressions. And I knew that I wanted my graduates to be well known for improving the quality, reliability of the care they provide by being competent and confidence exuding from delivering high quality CPR. And so that was the main reason why I wanted to do RQI and be an early adopter. I saw it as a win-win for not only the nursing program, but also for clinical practice as well. Thank you.
Yes, thank you. I love how you were focused on high quality, because if you've only done something once, it's hard to be really good at that. And that's what RQI is. It's a mastery program. So thank you for wanting to focus on that. Julie, would you share CCAC's experience and your thoughts on why you adopted?
Yes, we to go along the same veins as Dr. Newbould and Dr. VanRiel, we wanted our students who go into clinical very early to be prepared as well as they could possibly be, especially because, clinical is unpredictable. So we had to give them as much as we could ahead of time to be ready. We also were very intrigued by the fact that clinical sites are going to adopt this as well. So we feel like the transition to practice was going to be much easier for them once they get through the program and they've used RQI for 2 years, that they'll be able to go in as a new nurse and be able to use RQI as well in their new workplace. So we like that that transition and that consistency that they would get with the program as well.
Yeah, thank you. And thanks for mentioning, the hospitals and the clinical partners. Just to let everyone know that there are over 2,500 hospitals across the US that are using RQI. And this is an AHA certification. So hospitals as well as employers can verify this credential. And so again, it just makes the students practice ready when they go into the hospitals. So your schools decided to adopt RQI. Let's talk about some of the challenges. What did you need to overcome within your organization to get RQI adopted? Let's begin with Dr. VanRiel.
Sure, thank you. Of course, being an early adopter, we kind of got a chance to experience this together. But one of the biggest challenges I would say is payment, and who's going to pay for it. And so I already knew, see, I'm at a HBCU. Our funding is not, exactly there for our students. And so what the university decided to do was we decided to pay for our students. Because we just knew we didn't want this to stop, and we knew how important it was. But also another challenge is faculty buy-in, because you want them to see how it can supplement and enhance what you've already doing in a class and not just another requirement that they had to complete. And so I talked with the leaders and I linked it to patient outcomes in the community, outcomes on campus, for cardiac arrest were to happen. And then I also wrote a business case for it as well.
Well, Very ambitious. I love it, the business case. And you're right, it can happen anywhere.
Mhm.
Julie, I know, would you like to share? You had talked about a little about faculty buy-in as well as possibly being a hurdle.
Yes, for sure. With any new program or process, faculty buy-in is essential. But you had come out to our site with Laerdal and had really went through everything and covered, for it being such a newer program, like you guys were very extensive in walking us through what that would look like. So we actually, once we had that, you guys come out there, they were pretty excited about it. So the faculty buy-in piece was less of a challenge than I thought it was going to be. The other challenge was, just getting the students acclimated to such a new, and the faculty, once the students were in there and using it, making sure everybody was comfortable with it. It's really easy to use, but it's just so different than what the traditional manner of CPR had ever been for training for them. So just making sure that we work through the little idiosyncrasies that come with anything new, and then trusting the process that they will be able to get through it and be able to be CPR certified. So, it was just the newness of it all, I would say, was the biggest challenge, but everyone's been overall excited about it, and it's been very smooth.
Oh, great, great. And we're going to get into more of the logistics later too, as to, some of the things you had to overcome and some best practices. Dr. Newbould, what challenges were you facing at Frederick Community College?
Yeah, so similarly, we struggled with how are we going to pay for it? And we wrote a grant through an innovation grant, and we're able to get RQI covered for all of our students for 2 years. And this included not just nursing, but respiratory therapy, physical therapist assistant, surgical technology, and our health and exercise science programs. Now, all of our programs needed something different, and we all use it differently. So nursing would use it more, but like health and exercise science or physical therapist assistant, they don't use it as often in their practice. And so we all have different needs. But nursing was definitely very interested in this, and we really wanted to make sure we had the opportunity to try it and everybody see how it could work for us. So the innovation grant was really important for all of us to see if we liked it and if we could continue it.
That's great. I had in my notes here too that the station was one of the challenges. Do you want to talk about that? And I know we've got a picture too to talk about how you overcome the station situation.
Yes. So once we figured out how we were going to pay for it, the next big thing was where are we going to put it? And for the number of students that we had, which was over 300 that we needed. So we had 2 mannequins, because you get based on the number of people you're going to enroll is how many mannequins you're going to have. So we needed a place for 2 mannequins that students could access. That there was easy access, but it was also a controlled environment so that, the equipment wouldn't get damaged. It would be easy to get to. So it had to be close to where the health sciences students would be for their classes. So we didn't want them going to another campus or going to the other end of campus. We wanted it close by. So we found a space in our library that students have to check in at the desk. They have to get a key for the room. And so it will be controlled. We use a sign-up genius so that students can sign up for a time that they're going to be in there. And that way we can control access and make sure that everything's visible, so nothing is hidden. If there's any kind of damage or something, we can see it more easily. And so there's some pictures on the screen, and on the left is the desk, the circulation desk, where students have to check in with an ID to get the key. And then the picture on the right actually is the door. It's locked, so you have to have a key to get into it, but it's also right by the lobby of the library. And then you can see the picture in the middle is the 2 mannequins, and so we keep them covered all the time. So part of the process of using it is getting the students to clean up after themselves and reset everything. But after we got the space sorted out and how to pay for it, I think everything else was a lot easier.
Oh, great. Thank you. Thank you for sharing the pictures. And as you can see, what the capabilities that the station needs is Wi-Fi and power. And we've got that here. And also we've got some security here with it as well. Well, I want to thank you for sharing your challenges and how you paid for it. I do have a slide, to just show some different payment models, because I know everyone wants to know how to pay for things. And grants, are a great way to get a program up and running and pilot so that your institution can start seeing outcomes and see if it's right for you. And so here's some other different payment methods you can use. The school pay really refers to a traditional business-to-business type model. And then we also have a no upfront cost to the school, which would be student pay. So once you enroll the student into the course, they would then pay for the course. And then we can do a blended as well. I noticed here that I have a hand up. Patty, did you have a question that someone had that was relative to what we're talking about right now?
Yes, excuse me. This was for Dr. Newbould. If you have time to answer this, do you have any more information on the grant that you received?
Yes, so we did, so it was an innovations grant, and so that's something that's in our state. But when we're searching for grants at our community college, we're looking for Perkins and especially access. So this was a big thing, was getting access. Not all of our students could get into a CPR class locally, so making sure that we found ways for them to do this. And then this addressed a need that we have for different variety of students to be able to have access, and that things that were going to lead to a certification. So that's one of the areas that in our state that a lot of our grants are written to, that are from local, state, and federal levels.
Great. Okay, so I don't see that there's, we are going to address questions at the end too. So we're going to continue to move on. So now we're going to start talking really about get into the nuts and bolts, into the logistics. And so, if each of our panelists could elaborate a little bit on the programs and how you're using these programs and incorporating it into your curriculum. Dr. Newbould, I see you're on my screen, so I'll go ahead and have you start, and we'll just keep going around.
So in the nursing program, and in most of our health science programs, we have it as a requirement for a course. And so to pass the course, the students have to complete their RQI, and it's twice in the semester. So because RQI runs on quarters and our semesters, the way that it overlaps over 2 different quarters, so they have to complete it twice. We do give them plenty of notice. They get lots of communication from RQI itself that something is overdue. We also print off the list about 3 weeks before the due date to make sure that we're capturing everybody. We don't want to fail anybody because of this, but we also feel like we give them plenty of support to make sure it happens. So it's a requirement to pass the course for us. Additionally, we offer the advanced life support and PALS. We offer that for our respiratory therapy students. So for their accreditation, that was one of the findings for our program, that they needed to have more support, especially for pediatric. And so offering PALS for those students was to meet one of their accreditation requirements. Because we purchase them as a school, and then we assign them to the students, we have excess. And so we make sure to offer those to students that are graduating from the nursing program for that semester. So they get ALS and PALS at no cost to them, which is kind of nice because a lot of our students are looking to go to ICUs and emergency departments. And these students have the opportunity to be one step ahead and ready and more prepared for some of these environments that are going into.
No, that's a great way to prepare your students to get them that first exposure. And as we're describing here, RQI does offer the advanced courses. They get assigned to RQI first, and then you layer on the ACLS and PALS. And those are strictly cognitive, so because all of the skills are done in the BLS course. So let's move to Julie. Julie, would you share, how you're incorporating it into your program and the programs you're using it in?
We are using it for our nursing students. We have 700 nursing students, and then we also have 17 allied health programs. So our next launch, once we get this under our belt with nursing, will be through the allied health programs. We do not require them to do RQI for the existing students. We did tell all incoming students that they were to do RQI for their CPR certification. So just keeping track of that's been, that's been different for us, but because there's accountability on the student too to have to upload their CPR card to a different area. So we're just requiring it for entry right now. With it being less than a year, that was our initial phase.
Mhm. Okay. No, that's great. And yes, you can phase it in. I mean, that's the beauty. You become like your own training center to be able to enroll people when you want. And so that's the beauty of it. Dr. VanRiel, would you like to talk about how you were integrating it?
Yes, so nursing was the first program to utilize RQI. And since we have added communication science disorder, which is our speech language pathologist, public health education, and we're going to add kinesiology and recreation administration. And so what we did is that we embedded it in a clinical course as a requirement before going to clinicals each semester. And I saw there was a question about competency-based education. It can definitely be incorporated into competency-based education along with simulation. You can use it in simulations or even take it into the classroom because the teaching station is movable. And for example, we've used it in our simulated community environment. So we have a room set up to reflect a home health situation, with the patient sitting in the client sitting in the chair, with the refrigerator, all the diabetic stuff with a needle stuck in them. And so, of course, it has a cardiac event, and then our RQ station is right there. And so students can actually go into the RQI station and then complete their compressions and ventilation. So it's been a wonderful experience for our students as well as our faculty members.
Thank you for sharing that. And I'm glad you brought up that simulated environment that you put RQI into. What a great way for someone to really apply what they're doing. RQI gets you ready, and then now let's put it into a real situation. So I want to, commend you for doing that. How very clever. So let's continue talking about, the challenges and best practices when you were implementing RQI. You may be using it a little bit differently today than you were originally set up. Dr. VanRiel, you're on my screen, so I'll have to let you start this time.
I will say when we first implemented RQI, we was like, okay, let the students complete it when they have time. And so I did introduce it to the students through emails, in-class presentations about how important it was. And so we decided, okay, we're gung-ho, we're going to start RQI. Students are going to run to the station and complete it. And that did not happen. We were like practically chasing after students to complete RQI. And so we figured out, okay, well, students we have these clinical courses that are offered each semester. So let's link it to the clinical because this is what we wanted for. So let's link it. And that has been successful. But another challenge that we faced, I think just recently, is that our traditional students, they don't take classes over the summer. And so when we started looking at the compliance report, we were like, oh, wow, what's going on? And then we figured out that, of course, if they're not having classes, they're not checking their emails. So they didn't even realize they were non-compliant. And so one of the things we did was our pre-licensure clinical coordinator. She verifies compliance documents for each student with the agencies. So it just makes sense that she reviewed the RQI compliance, and that has worked out great for us. So there's some things that we did learn and made adjustments with and continue to learn. So thank you.
Definitely. No, thank you for sharing those best practices there. Julie, would you like to talk about, other challenges you faced, or if you're using it differently today, or best practices? So our audience out here has some great ideas moving forward.
So our biggest, because we actually, you said 5 campuses, we're down to 4 now. We merged 2, but we have four different locations where these RQI stations are set up. So everybody was super nervous about just letting the students come and go to do their modules. So the logistics of having that lab space available to them and when was a hurdle, I would say, for us. But we have since relaxed that, and we have security aware, that the students will be coming in to do it, and it's logged. So we see when the students are using the mannequin and the cart. So it's not been an issue with having them use it. They were worried about vandalism. We haven't had any issues with that. I mean, they're very respectful of the whole cart and the mannequin, so we haven't had any issues. So that was our big concern and our big hurdle in the beginning, was meeting the student need of coming in and doing it. And because we were requiring it for entry-level students, or their first semester students, they were nervous about everything anyway. So we did end up having a lab person, open lab person, just there, kind of in the mix if they needed help. Just to give them that little bit of confidence to be able to go through it. And I think that's just sheerly because the whole lab, everything's new to them at that point. So we did find having a support person in the beginning accessible to them as helpful.
No, I think you bring up a really great point. And actually, I'll move to Dr. Newbould too, because I believe you had, to change some things up as well as assigning someone with the station, and we're going to move more into like the time it takes you to manage this program as well. So go ahead, Dr. Newbould, if you want to share.
Yeah, so when we first set it up, we didn't have to chase the students initially, like, some that was already said, because we made it a requirement for the course. So people were pretty motivated to get in there. However, they were also very nervous, and figuring out the first round, like what are the frequently asked questions? Where are the students having issues? And so we had to identify somebody that could go respond, who was going to stay updated on what the frequently asked questions or problems were. So some of the things that would happen was the mannequin would become unplugged. So they would pull it too far away from the wall and something would unplug close to the mannequin. And it was an easy fix, but until you know that it happens, that's not necessarily the person you look for. We also found that students didn't know how far back to tilt the head on the mannequin. We also found lipstick on the mannequin one day. So these were all things we had to say, like, okay, like they're just not following, or we didn't know they were issues until we got into it. We assigned one of our simulation staff to be available. We had their number at the desk as well as posted in the room where the mannequins were. So if there was a problem, somebody was available and we could take care of it and help them. And within a few weeks, it was fine. We didn't have any problems. And by the second quarter that we were doing it, we didn't have anybody calling us. And it's interesting because as we bring in a new cohort, we don't have those questions anymore. Like they've figured, and you would think that every time you would bring in new students, you would have the same problems, but it's not happening anymore. So it was a very quick buy-in from the students as well, as far as coming on board with us.
Yeah, those students they talk to the next cohorts. Yes, and I mean, all of you brought up great points. As an RQI administrator, definitely have some other people to help, and we are here to help you. Have some coaches or super users, someone to be, that's boots on the ground to be able to help students if they are having problems and have trouble. So we are here to help you. This is offered as an end-to-end software as a solution program. And so you've got the tech support and you've got customer service support to help you get your organization up and running. So we're going to move to about the amount of time that your institution is spending managing the program. Again, this wasn't something you did before. It was outsourced. So let's talk about how much time this is really taking you. And Dr. Newbould, you're on my screen, so we'll start with you and then keep going around.
Initially, it was the first few weeks we did it, there was definitely more of an investment, but having somebody that was assigned to answer the questions, we had to make sure somebody was here. But then once we got started, it's really not a lot of time. We send out a sign-up genius every few months to make sure that everybody's getting it in there. But the sign-up genius goes right to the desk at the library. So they always have a list as to who's going to be there. And so it's really, less than 30 minutes a week of somebody managing it at this point.
Okay, great. Julie, would you like to share the time that it's taking you to manage the program?
So as you know, Betsy, we've had a transition in leadership. The person who was the lead on RQI, had gone on a medical leave. So I kind of, as well as I knew it, I wasn't the one down in the weeds with it every day. So that's been new to me in the last, like from September on. So just the loading of the rosters. And the other caveat to our situation was our college migrated all the student email addresses into a different like handle. Like it was like an acd.ccac.edu to just, they took the ACD out. So that was an extra little hurdle that we had because now everybody's email address changed and we didn't have a very smooth migration. So my situation was a little bit unique because we had some technical issues on our side. But overall, once we had people in place to help the students actually work through, just like Dr. Newbould said, some of those little tiny things that you don't realize are going to happen at first. It's been very smooth and not not a lot of time. Out of all the processes as administrators we deal with every day, RQI isn't up there with the time consuming one.
Oh, well, that's very refreshing. Thank you for that.
And your support's been great too. I should say that too. Anything I need, you guys are immediately responsive and able to help me through it. So that's been a huge time saver for me.
Thank you. Thank you. Yes, we can thank Patty. So anyone who adopts RQI, you will be assigned a dedicated impact manager, and they will be your resource to go to and to lean into if you need help with reports and just managing your program. Just to give you an estimate, so to get your program up and running, Laerdal usually estimates about 4 to 6 hours to get everything up and running on your platform and your station. And then, like they're saying, managing the platform is just really uploading new cohorts, inactivating students that are graduating, and running your compliance reports. So let's move to Dr. VanRiel. Do you want to talk about how much time it's spending you at your institution?
Sure. I would say that it's definitely in line with what the other panelists have said, far as the time spent, because at one point I had lost 2 other people who was managing it for me, and then I was doing it. And so thank God students were, self-sufficient. And if they had any questions, they would call customer service. We have it right there on the board for them to do. And other than a couple of times saying, I think the door is locked, was the only issue I have with even other departments using it. There's been no issues. That has been working out really well. And students probably spend about 15 minutes on it. So that was the approximate time that I've seen them go through it. So it's been a great experience for everyone and not too long. That because students like, oh, I don't know if I can complete it. And next thing you know, they're all done. So yes, it's not far as a lot of time management for them as well.
No, this is great. We got some great key takeaways here. Some I'll just highlight here is, it's really important to orient and have the students understand from the beginning what RQI is about and the benefits to them. Establishing your plan for the RQI requirements within your school and who's going to be enrolled. And then the last, establishing a team of RQI administrators and coaches to assist you with the program. So we're going to go to feedback. I guess it's important to understand really what is faculty and student feedback then. If you want to start, Dr. VanRiel, that would be great to hear.
Sure. Students have, one of the students said, man, I wish I had this when I was in the program, because she went to work right away in the ED and she didn't feel secure with her codes. But since students have graduated and started used RQI, they have transitioned well into clinical practice. Also, it's been said, a lot of the hospitals are now using RQI, which makes a big difference, because then that's less that they have to worry about when they go into a code situation, that they will be prepared to do this. So, this has been a wonderful experience. I have to give a plug for Laerdal as well. because I mean, they are there with you. If you have questions about the compliance report, I know Patty is with us and she has been wonderful to ask questions, and when I needed to add other departments, she was quick to meet with all the other departments as well. So I just wanted to say that information and how much that I appreciate the team and for their responses to questions, mine and students as well.
Thank you for that. Dr. Newbould, do you have some feedback from any of your students and faculty?
Yes. So from the students, they just feel like, okay, this is easy to do. It doesn't take them much time. They've gotten very used to it. They also do say that they are more comfortable. We've had a few students that come back from clinical and had a code, and they report they felt like they knew what to do and they were ready to be in there to help. Our clinical instructors, we have a lot of them that have worked as emergency room nurses for years and have done recertifications very often and multiple times. And I, had one that said, wow, this was such a great review. And I felt like I got so much more feedback than I do from just the general class that you take. So they were very impressed with it, even after having taken the traditional classes and recertifications multiple times. Our partners that hire our students are very happy with having the certifications, and they're ready to go. And not only do they have a certification, so previously they would come into our program and they'd have a certification, and so they would have like a few months left on it by the time they started their new jobs. Well, now they're starting their new jobs with a 2-year certification and the confidence and the up-to-date skills. So they've reported, a lot of satisfaction with that. Our clinical partners are not using RQI yet. However, they are now seeing like there's more conversation about it because of our students going there so much and talking about it.
Oh, thank you for that. So I'm looking at time here, and I know the audience probably wants to hear about some results. So I'm going to move forward here into some of the results. So Dr. Newbould, you're on my screen. I'll have you go ahead and tell us about, what you're seeing. What are the results? Was it what you expected? Is it something different?
Well, I had really high hopes just from the presentations I had seen before we started it, and I think they've all been met. We had hoped that our students would be more confident, and we're seeing that. We had been doing multiple simulations with CPR, just doing the basic steps every semester before they went to their clinical practice. And so we've been able to get that time back, and so we can do other simulations now. And so instead of just focusing on just the basic steps, making sure that we reviewed it, we can now move on to more advanced simulations where they can start doing the team aspect and changing out the compressors, and start for the senior students, bring in the advanced life support components as well. So it's allowed us to have more time to be able to do things in simulations that we had to just do basic level stuff before, because as a review to make sure they were ready. And so that piece is covered now. So it has opened opportunity for us to do other simulations.
I love that. Yes, that's great. What a great way to then put it to practice now. Julie, would you like to share the results you're seeing, your outcomes?
So I did not, I'm sorry, I did not pull any of that data. I actually completely forgot before today, but I can tell you that the feedback from the students, I talk to them every day, all day, and the faculty, is the time saver. They really felt like this was a much quicker process for the ones so now we're getting some that are coming in to renew, or others that already had their CPR, they're watching this and they're talking, and they said, I wish we would have done it this way. I didn't realize it was this efficient. So we're getting a lot of positive feedback on how smooth the process has been, and how short of a process compared to taking a traditional all day CPR or several hours of CPR class.
Mm-hmm. No, thank you for that. And actually, I'd like to share too that both Frederick Community College and CCAC have been just under a year. So the data that you have in the background on the platform, you can compare the students' baseline when they start the program, and you can compare quarter to quarter to show their improvements. And you can also show baseline to baseline a year later. So from Frederick and the Community College of Allegheny County, they're just getting that data. So I'm sure they're going to have to look at that data and extrapolate that a little bit. But all that data is on the background for you to look at. And we do have data that Dr. VanRiel, again, she's been doing it for 2 years. So she's got some data here that can really show some outcomes. So I will let her speak to her slides.
Thank you. I know there was a question that just came up. Is there a minimum number of students needed in the program to implement? There is not a minimum number because my school started out very small. But as we have grown, you'll see that we have 94,560 compressions that have been performed at the RQI simulation station. And we've had 18,228 ventilations done at the RQI station. And this data is up to September, and so far it's 169 students. So very, very happy with seeing the results. I can tell you that, and when she shows the next slide, that one of the things that I will tell you about the students and after reviewing the data is that their self-assessment questionnaire, they are so confident that they're very good at high quality CPR on an adult or child. But when you look at the data, there is definitely a mismatch between the students' confidence and their ability to perform them. And especially with infants, which, you know, I guess I can understand because students don't really, they work more with adults, but still it was kind of surprising that how confident they were. But some of them had just completed CPR right before they started in the program. And so they were all of them were high, even if it was less than 2 years, they still had high confidence, but it didn't match. And so this one, you'll see with the slide that how low it is without feedback. You'll see that compressions, ventilations, and comparing the adult and the infant. But with feedback, look how much it increased. So our adult compression performance increased by 84%. Infants by 447%, and ventilation for adult by 180%, and infant ventilation by 126. So it definitely shows, and like my colleagues were saying, when students, they're continually getting this updated for their CPR, it's American Heart Association. A lot of the hospitals that utilize RQI, they don't even have the classes anymore. They do it right there, just like the students. So that's one way the students are definitely prepared when they start. And there's 2 hospitals that I know of, might be more in North Carolina, that has it. And one of them is also on my advisory board. And actually they learned about it from us talking about North Carolina Central being involved in it. And I can tell you, because I also work there, that I hear a lot of the same things I hear from the students as far as like performing. Oh, that infant was so hard to do. And also they do utilize it for ACLS and for PALS as well. So, and they have the stations throughout the facility. And one of the things that I'm also doing is we're going for a grant so we can have more stations and make it university-wide, but also have some community members as well come over and utilize it as well. So it's been very, very enlightening, very informative, and definitely impacts the population. Thank you.
Yes, thank you very much for sharing your data and sharing your stories. I'm sure the audience wants to get their questions answered. So we're going to go ahead and move to the Q&A. And Patty, if you want to toss out some of the questions, those burning questions that are out there, and the panelists can answer, and we'll figure out who needs to answer it to get there. And we will try to get to all of them and follow up with you if we don't for some reason here.
Yeah, thank you. So we've been answering some questions along the way in the chat, and everyone should be able to see those. But let's answer some that came through the Q&A. One question, or it was just a statement, I guess, is could any of the panelists maybe after the webinar, share a sample of their curriculum showing how RQI was embedded. That was just something, I don't know if that's something we could send out afterwards, but I wanted to mention that because that was asked of the panelists.
And I'll just interrupt and say, we are going to show you a slide with a QR code of each of the panelists' LinkedIn site, and they are open to you reaching out to them. So you will be able to reach out to them directly as well and maybe ask for that.
Another question that came in was a price point, and is there a minimum number of students needed to implement RQI?
Oh, and I can answer that. There is a minimum because we are going to be offering you an end-to-end software as a solution. And it's a very flexible program and the different courses you can offer. But the base program is $7,000 a year. And then we can talk to you about how to adjust that and to work with that program. But we're going to provide end-to-end all the equipment you need for those numbers. And figure out your courses. So you'll definitely need to reach out to a Laerdal Impact Manager to customize it for your institution.
Thank you. Another question. Are students using Global ID or do they start over once they are employed?
Great question. I can answer that too. Yes, so when students would start at a hospital, they would bring that card. They can verify that right there on their card. That is true RQI card. No one made it up. And then most of them are putting them into the entry assignment, which is just 25 questions, and gets them into the hospital's RQI site. We are working on a global ID, and so we do hope that will come soon. And what that would do for a student then is if they were in their third quarter of RQI at school, when they went to a RQI hospital, they would continue in that third quarter and there would be no hiccup in their journey. But we need to get that right. And so we're still working on that, but it is soon to come.
Here's a question. Is it a possibility to have one lab space with multiple schools using the RQI system?
So I can answer that. I mean,
yeah, please do.
We have our station here in the nursing building, and we have the two other departments, and right now their students come here and we leave the doors unlocked. They just go up to the second floor, which is our Eagle General Hospital, which is what we call our experiential learning center. And students can go in there and just complete it. So right now we're sharing the station, and it hasn't become an issue at all because our building is open from 7:30 to 7:30 at nighttime. And so students can come during that time, and we hadn't had an issue where students were there at the same time. But I definitely, like I said, was looking at getting another station and will possibly put it in a different, room in Eagle General Hospital, but definitely keeping it here so we can all utilize it. So it hasn't been an issue, but maybe my other colleagues, I like the idea of, having it in the library, but I think that's very innovative as well.
Yeah, yeah. And I'll tack into that too. So we're definitely, we can help you with that and talk to you about it. There's some logistic questions we'll need to work through, but that's certainly a possibility.
Another question. So RQI is used for the BLS certification. Is there a possibility to offer RQI to outsiders that are not students at the school?
Mm-hmm. And I can take that. Yes, it is. So you have this site, and we publish the number of courses that you want to this site. And so, yes, if you have a first name, a last name, and an email, you can assign that person the course. We also do integrate with learning management. So if you were connected to a learning management, you would only be able to give the courses to people who have access to your learning management. So depending how we integrate with you, you certainly can offer it to the community. In those situations, it's usually a direct site that they're not connected to the learning management, which gives you that flexibility to offer it to anybody. Thanks, Patty.
Yeah. Question came in about the time to complete the assignments. How much time is it taking students?
I'll let one of our panelists answer that because we want to hear and what's really happening. We got numbers, but let's just see what the students are doing.
So our students, initially when we started, we didn't know how much time it would take them. So we gave them a half an hour each, or I think we started with 45 minutes on our Sign Up Genius, and then we bumped it down to 30 minutes in our Sign Up Genius time slots. They take maybe 10 minutes to do it. And so the 30 minutes just allows them to clean up and make sure that they're out of there before the next person comes in. So we haven't shortened that at all. And I would say 10 minutes. And I do it too. So all of our faculty also do it. And so I would definitely recommend that, so you know exactly what the students are experiencing as well.
And the same here. It's about 15 minutes. We don't use a sign-up genius, but students can come in like they're on break, or they don't have a clinical that day or before class starts. And so that's what we do here. And I would like to say, even though, this is a university, this is also the same no matter what level that you're at. Community college, university, it doesn't matter. This is all the same. So I would like to put that in. So if you want to contact me when this is over, feel free. Because I will gladly help you and provide you with information that we have utilized as well. But I do say that students just get through it, and once they do it, they're done. I mean, one day I had to meet a student down there because she thought the door was locked. It turned out it wasn't. But anyway, I met her down there, and the next thing I know, I saw her, she was leaving. I said, "You're done?" And she was like, "Yeah." I was like, "Okay." So I think when they're first doing it, they think it's going to be longer than it actually is. And then they realize, wait a minute, I got this. And so I want to point that out as well. So students initially might be thinking it's going to be a long time, but it's not.
Yes, yeah, thank you for that. So the initial, once they get that initial 2-year card, their skill session, doing their baseline, and then their grade for their 4 core skills, that plan on it being about 30 minutes, okay? Because they're getting used to the station and they're listening to what the station's telling them. But like as our panelists are describing, once they're familiar with that station, their quarterly skills should take less than 10 minutes. And even their quarterly refreshers and cognitive is only about 10 minutes. So you're looking at tops of 20 minutes every 90 days for them to refresh.
I think we may have answered this in chat, but I just wanted to review this question. Does a student need to be certified in BLS to enter the RQI program?
No, they don't. And this is one of the things that we are actually going to change with our next mitten class, is to require them, we're going to set time during orientation and to do RQI. So everybody starts at the same place. Because like I said, we were finding out students' cards would expire on different times, or they wasn't compliant. We said, okay, you know what? Let's start them at the beginning so they don't have to worry about paying extra for CPR before they come to the university, because that's one of the things that we're finding that students were paying, and this will also save them. We also had a faculty member who was our RQI manager. He retired, but he would do CPR for everyone when they came in, and then he was like, you know what, let's use RQI. So that's what we're going to do now, and just add it to the orientation and start them from day one.
Thank you, Dr. VanRiel.
I have.
Oh, yeah.
sorry.
I'm just looking at the time. If you
Yeah.
have another one, we can take it. I did want to make sure we got our QR scans up there as well so that they could reach out to our panelists. So you let me know what we got for questions.
The last one, just to, this may have been touched on as well, but are you using RQI in conjunction with simulation?
Not in conjunction with simulation, but like I said, it allows us to be able to add simulations or more advanced simulations into our time, because we're not having to do the basics. But we don't have the mannequin as a part of the simulation. And I'm not sure how that would work because of the way it's set up. Each student is logged in as their own person on the computer, and the computer is giving them feedback on how they're doing with the compressions or giving the breaths. And so I don't know that it would work in the simulation, like if you actually made it part of their simulation. So it's already grading them, and adding that onto it, I think would be more effective to use your simulation time with creating a scenario that they were working with a team.
Mhm. So I was noticing a question that popped up as you were talking, Dr. Newbould. So basically, they've practiced, they got that skill, and now you're actually putting them into a mock code. So now we're really applying it, so you can think about your role now within the team. So, okay. Well, again, I want to thank our audience for joining us today. We hope that you found this informative. As always, we run out of time in these type of robust discussions. Here are the QR scans for each of the panelists. You're welcome to use your phone and take these and reach out to them. And thank you. We hope that we'll be talking to you. On the next slide, you're going to see a QR scan to reach out to your Laerdal impact manager. So it'll grab your information, and then they will reach out to you, and we can set up a call to talk about RQI at your institution. Thank you very much. And I would thank the panelists for their generosity of their time and sharing their journey. You are really, making a paradigm shift here in how we train and prepare our future healthcare providers. So thank you very much for that.